Good afternoon. My name is Arroyo, and today I would like to chip away at the real Nobel Prize question, and that is, how do we ensure that patients take ownership of their own preventive health care? And a huge part of that question is, how do we identify those who will be most receptive to our message? Today, I'll be presenting the project entitled Age and Motivation to Exercise, data from the LifeWise randomized video trial in the emergency department in patients presenting with chest pain. So firstly, I'd like to state that I'm a postgraduate CRISP clinical research scholar focusing on lifestyle health research, and I'm funded through the University of Michigan. So now I realize I'm preaching to the choir quite a bit here, but it's intuitive that preventive medicine is far more impactful than curative medicine. So rather than waiting and treating patients when they come to us with a disease, it would be far more impactful for that same patient to implement lifestyle behaviors in order to prevent that disease from ever occurring in the first place. So some of those healthful lifestyle behaviors include diet, exercise, sleep hygiene, and smoking cessation. And the trans-theoretical model of change suggests whether the patient is in the pre-contemplation, contemplation, preparation, action, or maintenance stage of adopting a lifestyle behavior. So in this project, we used nested data from an ongoing pilot study, and we sought out to evaluate motivation to perform exercise as a function of age and use of a video intervention. So as I stated, the exercise data was used from an ongoing randomized, non-blinded prospective pilot study of a video-based educational intervention for adult patients with low acuity chest pain. So in order to be eligible for our study, the patient had to first present to the emergency department with a chief complaint of chest pain and have an emergency severity index or ESI acuity rating of 3, 4, 5, or 2 with normal vital signs. Once they consented, the patients were randomized to receive a 10-minute preventive lifestyle behavior video and then completed a research associate assisted questionnaire. So the results from the readiness and confidence to change questionnaires, as well as select questions from the US HCAHPS patient satisfaction survey were analyzed. And then the subjects in the study, those who were aged 18 to 39 and 40 and greater, were grouped in a dichotomous fashion with respect to currently performing exercise. And to analyze those results, descriptive statistics and a Fisher's exact test were used. So this is the consent and enrollment process. 239 patients were screened, 143 declined to participate, and around 6 patients left before the intervention could be completed, whether they were discharged or they withdrew from the study. So in total, 90 participants enrolled and were subsequently randomized to either receive a video or not receive a video. 39 participants received the video and 51 participants did not. And all of those participants filled out a questionnaire. So I apologize for the small font here, but hopefully you can bring your attention to the 10 lifestyle behaviors. So this is the readiness to change questionnaire, one of the questionnaires we used in the survey. And we grouped these 10 lifestyle behaviors into separate domains, those being exercise, diet, avoiding smoking, and living an overall healthy lifestyle. But today, I'd like to bring your attention to the first 3 prompts, and the patient would determine whether they perform exercise at least 5 times per week, incorporate extra physical activity throughout their daily routine, and whether they participate in a sporting activity at least 1 to 2 times per week. And based on those behaviors, they would give each behavior a rating. So a 5 meant they had no interest in the current lifestyle behavior at this time. So that would indicate that they are in the pre-contemplation stage of the trans-theoretical model. A rating of 4 indicated that they were thinking about implementing this lifestyle behavior sometime in the next few months, and that would mean they are in the contemplation stage. A rating of 3 meant that they plan to implement the lifestyle behavior sometime in the next month, meaning that they are in the preparation stage. A rating of 2 indicated that they were in the action stage, since they indicated that they recently began this lifestyle behavior. And a rating of 1 meant that they have been maintaining this lifestyle behavior for more than 6 months, or the maintenance stage. So of the participants enrolled, the median age was 48.7 years. There were 52 females and 38 males enrolled. And among those included, 60 had an ESI of 3 to 5, 30 had an ESI of 2 with normal vital signs. So for our first test, we considered a score of 1 and 2 from the Readiness to Change questionnaire as already performing exercise. And those groups that we dichotomously fashioned before, we compared whether they were already performing exercise behaviors or not. And so we found that those who were age 40 and above were more likely to be already engaging in performing exercise behaviors. But although this was an insignificant result, since we had a p-value of 0.777, but still it's an encouraging trend to discovering which age group is most receptive to our message. In addition to that test, we completed a student t-test comparing the mean readiness to change scores of 2 groups, those 2 groups being those who received the video intervention and those who did not receive the video intervention. We found that the mean readiness to change score of those who watched the video had a readiness score of 3.96, compared to those who did not watch the video, they had a mean readiness score of 4.0. So the lower the readiness to change score, the more ready they are to perform that exercise behavior. But once again, this was found to be insignificant since it had a p-value of 0.23, but still it was a positive trend towards increased readiness following the intervention. So in this pilot study with limited enrollment, although no significance was found, there was a trend for older patients, those who are 40 and above, to be more likely to engage in exercise, and for those who received a video intervention to be more ready to engage in exercise behaviors. So moving forward, we would like larger studies so that we could possibly narrow the age ranges so that we could find out which specific age groups would be most ready to engage in exercise. Here are our references. And this is the link to the video I talked about earlier. It goes over topics like sleep hygiene, smoking cessation, diet, and exercise. It presents what seems to be fairly easily digestible information about those topics, but we encourage you all to scan the QR code, share it with whoever, and moving forward, we are in the process of creating a more definitive study of a multi-center RCT. So if you believe that your institution would be a great fit for enrolling patients, we encourage you to speak to us after this presentation. Thank you.
Thank you, Dylan. We do have time for one quick question. Yes?
Do you know the proportion of individuals that were in the no intervention group and intervention group for the age range? Because you said that the older ones were more inclined to get into physical activity. So did you adjust for age, or did you consider that? Did you see that they were more into one group than the other, maybe?
No, that's a great question. But that is, as off the top of my head, I don't know that right now. Which age groups received which intervention. But moving forward with our definitive study, that's certainly something we should consider.
I'll just mention that the ones that were included in this study was just a measure of what they're already doing. So the video didn't necessarily, the main outcome wasn't impacted. So.
Great, thank you.
Thank you. Great question.